So obviously this is where we get gloves. Hand sanitizer if your hands are soiled, obviously, just like standard precautions. We're going to wash our hands. You have gloves here. We have extra burrs if one were to get soiled with blood, and we'll go over that in a minute. There are extras here. If you are in the middle of something, you can always call us over. We'll help you guys find the right one. Cotton and our Q-tips. We use that sometimes with when we're using special products. 3W for putting on callus, to soften calluses. We have some ethyl chloride and gentian violet. I don't know what you guys saw on the video, but gentian violet is for the maceration, and the ethyl chloride is kind of a distractor, pain reliever. There is biofreeze in here, more ethyl chloride, and hand sanitizer. Excellent. We ask that they remove their toenail polish before coming in, but if they have not, then we have toenail polish remover here with some cotton swabs. When we use 3W, we put it on cotton swabs and then wrap with this, but we'll walk you through that as you go along. Any questions about this area? Okay. So each station is set up exactly the same with the exception of the vacuum sander, and I'll show you both types. So everything that you would typically need or that you throw away will be in here. So we have our nippers. There should be a pair available for every single patient. We do not reuse these. They will go in the autoclave, and I'll show you that in a minute. So muffin tins, we put those up here as not to chase after our burrs. And I'll set this up here in just a second. Our chlorhexidine alcohol combination, that would be for any injury that may be caused. I prefer to use it after every patient when I feel like they're complete, because it is best practice for prevention of bacterial colonization, at least in the short term. Here we have our wipes that we will use once the patient is done. We want to make sure to clean out from between the toes. We have gloves to help put on TED hose, and a shoehorn if necessary. Down here we have our covers for our tray. Once we're done, we're going to wash this tray, and this is how you're going to set it back up. You have your cover. You have the paper, it's a dental bib, it goes right underneath their feet. I'm going to put out new nippers. I put out my chlorhexidine. I put out a muffin tin. You're going to have your clean burrs. This is a one-way valve, so we blow off any dust that isn't picked up by the vacuum sander. It gets down in those crevices if we want to look or we're occluded by toe dust. And then your mirror, because when you take a patient's shoes off, you do want to see the heel, see for pressure areas, wounds, sores, anything like that, cracks, calluses, and such. So you are going to take off their shoes, socks, and then immediately do your assessment, which includes looking underneath. Your cavi wipes for cleaning, I should have mentioned, are right here. Any questions about this setup right now? So this is So this is our vacuum sander, one of two different types. The way you turn this on and the way you insert the burr are going to be different. So that's really the only two differences. Here we're using 15, and that stands for 15,000 RPMs. So just keep that in mind. This is the level of suction. Usually it's 3/4 of the way. So if you're left-handed, you would turn it 15 in reverse. We have alcohol here. If we need to get the toe wet, sometimes moisture will help us to differentiate between skin and nail, or callus and regular skin. And then of course your lotion after you're done and you've had your final check. then you will lotion their feet and get them set to get out the door, okay? Questions? All right, so our chair, all the controls are here on the side. There is also a controller. These do work. The eject button on some of them does not. So for this, there is table up or chair up, obviously chair down. I like to get people in the chair and tilt them back first, because if you put their back, this is slick, they could slide out. So my preference is just a little tilt. I like to warn them that it could be abrupt so that people don't get startled. And then of course the back if need be, of course to their level of comfort. And then we're going to put their feet up. My preference is, if I can kiss your feet, they're high enough. So I'm not asking you to do that, but so I want them up so that their feet are about here. I want to be able to maintain good posture. And then of course, when they're ready to get out, you can try and hit the eject button. It might work, it might not. There are a couple that don't. It's a star button. You hold it down for a ridiculously long period of time. When you think it's not going to work, it typically works. One part that is always forgotten is the tilt. So when we're getting patients out, we've lowered the chair, we put their feet down, but we've forgotten that the tilt needs to go down, and our more petite patients have to kind of slide out. So please try and be cognizant of that. Questions about the chair? All right. And then of course our light, it's a flat button. It doesn't actually have a button itself that you can click. It's just a touch on and off. Please make sure to use your light. It's so helpful. Okay. When you're done with the chair and you're ready to clean up, patient has left, you're going to rip this off, put it in the black garbage behind you. That helps us not to fill up our garbages here. You're going to take your dirty burrs and your dirty clippers, and we're going to just pretend like that's what we're doing now. Okay, so we're going to take these, they're all dirty, and we're going to walk them over here. So, just for example's sake, this one has blood on it, this one does not. So we're going to want to take our burr, just dip it in its Dawn dish soap, and we're going to clean off any of the debris thoroughly. We're going to dip it in the water, and you want to pat it off. The less water that goes into the enviricide, the longer we can use it so it is not dilute. You're going to set it in there. It has the instructions here. It says for a minute, and a minute happens to be the same length of time it takes to clean and reset your station. So we're going to let that sit in there for a moment. This one has blood on it. We're going to clean it off, but it has to go in the autoclave. Absolutely has to go in the autoclave. Your dirty nippers and curette will always go into the autoclave. There are plenty of nippers and curettes to go around for the whole day. Okay, so then you're going to throw these away, and when you get your new burr out, you're going to just put it here, maybe, and we're going to go back. And I don't have these you do not see. And then we've set up our station, we've pulled the paper down, we've cleaned this off. I like to give this a little wipe, but please do not get any moisture inside the vacuum area. And my thing is open. I'm going to put these back in. And then I'm ready to go again. So that's when you would go to Shirley's desk and call your next patient. Questions about cleaning?
You said when we clean them, we clean with the Enviricide, or the
The
wipes.
cavi wipe, yes. For all intents and purposes, I'll just grab it and do this and just once down. We really want to get the dust off. We're not going to be rubbing the tube on the patient's feet, but just for cleaning and such. Okay, so let's move on to the other vacuum sander. Like I said, this one's a little different. How we put it in and how we turn it on. So, with this handle, you're gonna have it in the up position, and you think I'm gonna put the bird down. And remember, you can set it on the motor, but then you lift it up a little bit so that it's not resting on the motor. So, in, down with the button. When you're taking the burr out, up and out. So the way you put the burr in is the same way you press the button. So down and down, up and up. There should be a light right here. Sometimes turning this on, there is a button here that will turn it on, and there is a button here. So you press the button on the handpiece for quite a few seconds, more than you'd think you should. So you hold it down and then it's on. This is your speed here. So if you press the button, you may end up at 20. If you don't hold it down long enough to turn it off, you might inadvertently change the number. So please do pay attention to what speed you are at. And again, this button can also turn it on, and that's just a press of the button.
So when you turn it on, does it go to the 15 right away? Or?
It should default to 15, but you can press or click the button once and it might go to 15, it might go to 20, but typically 1 or 2 presses of this button and you will get to the right speed, or you can increase and decrease with the plus and minus. For our left-handed people, that's called, oh my goodness, so I should probably turn on, it's reverse, but it calls it something very odd, and that again is only for left-handed people. So, questions about this vacuum sander? Okay, I think that's it. There's our sink. It is not plumbed, so you will see that we've got an innie and an outie, and there's only so much water and there's only so much area to drain the water. So if indeed your hands are soiled and you need to do the thorough washing, the CDC recommended washing, please don't do it here. And if you're rinsing something off for whatever reason, rinse and then turn it off. Otherwise, use the sink in the back or the bathroom around the corner.